Hello, my name is Mariah Pitak, and today I will be discussing with my patient, Mr. King, his treatment plan for his new diagnosis of Parkinson's. So a little bit of the background. Mr. King is a 60-year-old male, and he presents to the clinic today for a new resting tremor that's developed in his right hand. He also complains of a stiff shoulder and says that he requires more time to get out of bed or a chair than usual, but he thinks that both of these are just due to getting old. Upon examination, I confirmed that he does in fact have a resting tremor in his right hand. I noticed rigidity in his right shoulder, and when conversing with Mr. King, I noticed hypomimia and also hypophonia. He does not appear to have postural instability at this time. Mr. King's medical history is significant for hypertension, hyperlipidemia, and GERD, and he does have a family history of Parkinson's. His father was diagnosed at age 62, and his uncle on his father's side was diagnosed at age 65. Hi, Mr. King. How are you doing today?
I'm doing well. How are you?
I'm well, thank you. So based on the symptoms you've been experiencing, like that tremor in your right hand and the stiffness, along with your family history, I feel you are in the early stages of Parkinson's disease. Do you happen to know anything about Parkinson's?
I don't know much about it, but my father and uncle both have Parkinson's, so I've seen them live with it.
Oh, I'm sorry to hear that. Parkinson's is a progressive neurodegenerative disorder, so basically there's not as much dopamine in your body as there should be, and that's what causes these symptoms you're experiencing. There are no real risk factors for the disease other than increasing age, and then research has shown that genetics play a large role. Unfortunately, at this point in time, there's no cure. So our goal for treatment will be to manage your symptoms as best we can and to provide you the best quality of life possible. I believe we were able to diagnose your disorder early, so hopefully we can slow the progression of your disease with medication.
So, will I be on medication the rest of my life, or are there any other things I can do to help?
So because this disease is progressive in nature, you will likely require medication for the rest of your life. However, aside from medications, there are some things that you can do to help. So Parkinson's patients are at higher risk for developing osteoporosis. Therefore, if you were to fall, you're at higher risk for fractures. So I suggest you eat a diet high in calcium and vitamin D, and that'll help prevent that by strengthening your bones. I also recommend high-intensity resistance training, which will help muscle strength and mobility.
Okay, well, my wife is into exercise, so I guess I can do that with her.
Wonderful. So now let's discuss options with medication, shall we?
Yes, that sounds great.
There are 3 primary drug classes used to treat Parkinson's disease. The most common and currently the gold standard treatment is a medication called carbidopa-levodopa. That medication does come with quite a few side effects, and the research is really conflicting on when to start patients on that drug. So because you appear to be in the very early stages of the disease, I don't believe we should start with that medication quite yet. Another drug class commonly used for Parkinson's is dopamine agonists. A common medication in this drug class is called Requip. These medications work by mimicking the effects of dopamine in your body, and they do have fewer side effects than the carbidopa-levodopa. However, they're still quite potent, and I like to reserve them for later on in the disease if we can. The drug class I would like to start with your case is called MAOB type B inhibitors. These medications work by decreasing the amount of dopamine broken down in your body, therefore allowing more dopamine to be present in your body. There are a few side effects associated with these medications, but I believe it's a great place to start because I do think we caught your disease early in the progression. It's my understanding that your symptoms are not yet quite interfering with your everyday life too much. Do you agree with that?
Yes, I think we caught it early. I am still able to work and play with my grandchildren for the most part.
Okay, good. So the specific medication I would like to prescribe today is called selegiline. This medication should help with your symptoms pretty quick because it does have a quick onset of action. Let's discuss more about it.
Okay.
Okay. So we'll start with the interactions because this is very important. Due to the way selegiline works in your body, you'll need to avoid alcohol and tyramine containing foods like aged cheese, wine, and nuts. Do you feel that'll be a problem?
I don't think so. I drink a beer here and there with the buddies, so that should be easy to avoid. I might have to change my diet some, but shouldn't be a problem. You have like a list of foods I need to avoid?
Yeah. We'll get you a list printed off that of foods that contain tyramine.
No, excellent. Thank you.
Yeah. So there are medications that you'll need to avoid as well. I see currently you're taking lisinopril for blood pressure, torvastatin for cholesterol, and famotidine or Pepcid for heartburn. Is that correct?
Yeah, and I occasionally take a Tums if my heartburn is too bad, and Tylenol here and there for my shoulder pain, but I don't take those every day.
Okay. So currently you're not on any medications that would interact with selegiline, but if a different provider were to prescribe you a medication, I just suggest that you double check that there's not going to be an interaction with the selegiline. Now let's discuss the side effects. The nice thing about this medication is there aren't as many side effects as there are with the other treatment options that we discussed. The main thing that patients do complain about are headaches, nausea, occasionally some dizziness. You can experience hallucinations and dyskinesia, but they're not common. Any questions so far?
What is dyskinesia?
Oh, that's a good question. Dyskinesia is a word for involuntary movements. So they're movements that you can't control.
Oh, got it. Okay, thank you.
Sure. Do you have any other questions about selegiline?
I don't think so.
Okay. So we'll plan on starting with 5 milligrams 2 times a day. They are tablets that you will swallow. I suggest that you take 1 pill before breakfast and 1 with lunch. And I would like to see you back in the clinic within 2 to 4 weeks just to reassess and touch base with how you feel the medication's working. If you begin to notice new symptoms or you feel like the medication isn't working at all, don't hesitate to give us a call right away. There are other medications we can try if that's the case. I do want you to know that it's not uncommon to experience other problems with Parkinson's like emotional changes, depression, anxiety, and bowel and bladder changes as well. So if you experience those, let us know, and there's different things we can do to combat those symptoms.
Okay.
Any questions I can answer for you today?
No, I'm looking forward to starting this medication. I hope it helps.
I do too. I'll plan on seeing you back in a couple weeks, 2 to 4 weeks. Let us know if you need anything before that.
Sounds good. Thank you so much.
You're welcome, Mr. King. Take care and have a good day.
Thanks, you too.